Good day, everyone. Today, me and my group are going to explain about problem-based task in subject information security management. Okay, before we start, let me introduce myself. My name is Lakshman, son of Nathan. My matric card number is 01DDT20F1083.
My name is Satyalango and my matric card number is 01DDT20F1093.
And my name is Sharan Ramhari and my matrix number is 01DDT20F111.
This is the question for our PBT task. COVID-19 pandemic is affected many companies in the global since 2020. As the global spread of the COVID-19 is significantly affecting organizations as well as individuals. Knowing how to reduce the accompanying risk is key. With more risk arising, such as cyber attack, data transfer, confidentiality issues, concerns about the resilience of primary service providers, project delays, or struggles with maintaining service and supply levels, it is important to take the right actions to organize your business as well as possible. COVID-19 is an illness that can affect your lungs and airways. It is caused by a virus called coronavirus. Symptoms can be mild, moderate, severe, or fatal. As the top management in your company, you and your team should suggest produce the risk management for your company, construct risk assessment form for dealing with the current COVID-19 situation in the workplace. It contains links to additional sources of information in key areas which may assist in developing procedure to manage the risk from COVID-19. And lastly, produce the COVID-19 prevention guideline among employees in your company. So let's see the first question answer. Produce the risk management for your company. Okay, these are the risk management for our company. Risk management is logical and systematic process that can be used when making decisions to improve the effectiveness and efficiency of organizational performance. Although most risk cannot be eliminated altogether, the management of risk involves identifying and being prepared for the occurrence of adverse events and taking action to avoid or reduce unwanted exposure of the organization to an acceptable level. Risk management encourages office to manage proactively rather than reactively. Therefore, it also means identifying and taking opportunities to improve organizational performance as much as it means taking action to avoid or reduce the chances of something going wrong.
So now let's see the procedure of risk management. So the step one is identify the risks. Anticipating possible pitfalls of a project doesn't have to feel like gloom and doom for your organization. Quite the opposite. Identifying risk is a positive experience that our whole team can take part in and learn from. Leverage the collective knowledge and experience of the entire team. Ask everyone to identify risks they have either experienced before or may have additional insight about. This process fosters communication and encourages cross-functional learning. Now, let's see the step 2, which is analyze the risks. During this step, our team will estimate the probability and fallout of each risk to decide where to focus first. Factors such as potential financial loss to the organization, time loss, and severity of impact all play a part in accurately analyzing each risk. By putting each risk under the microscope, we will also uncover any common issue across a project and further refine the risk management process for future projects.
So let's see the step 3. Prioritize the risk. And now prioritization begins. Rank each risk by factoring in both its likelihood of happening and its potential effect on the project. This step gives you a holistic view of the project at hand and pinpoints where the team's focus should lie. Most importantly, it will help you identify workable solutions for each risk. This way, the project itself is not interrupted or delayed in significant way during the treatment stage. Step 4. Treat the risk. In order to treat risks, an organization must first identify their strategies for doing so by developing a treatment plan. The objective of the risk management treatment plan is to reduce the probability of occurrence of the risk, preventive action, and or reduce the impact of the risk mitigation action. For an opportunity, the objective of the treatment plan is to increase the likelihood of the opportunity occurring to increase its benefits. Depending on the nature of the risk or opportunity, a response strategy is defined on the project. Next, step 5, risk monitoring and reporting. Risks and opportunities and their treatment plans need to be monitored and reported on. The frequency of this will depend on the critically at risk of. By developing a monitoring and reporting structure, it will ensure there are appropriate forums for escalation and the appropriate risk responses are being actioned.
Now let's see the second question's answer. Construct risk assessment form for dealing with the current COVID-19 situation in the workplace. It contains link to additional sources of information in key area which may assist in developing procedure to manage the risk from COVID-19. For this question, we have created 4 forms for risk assessment form. So let's see the first risk assessment form. First, we need to identify the hazard. Working near others where physical distancing cannot be maintained. Who might be at risk? Workers, customers, and visitors. Now, how to control to eliminate the risk? Wear a medical mask or face covering when physical distancing is not possible. Cover your mouth and nose with a tissue when you cough or sneeze or cough into your elbow. Practice physical distancing for 1 meter as much as possible. And lastly, always keeps body neat and clean. And the actions, having a supervisor to check workers or customers, visitors whether they are wearing masks and keeping physical distancing or not. And keeping signboard of 1 meter physical distancing to make people remember and to follow. And the third one, keeping banners on the importance of physical distancing and the risk if they avoid to do in cafeteria in all the departments. And lastly, sanitize the workplace twice in a week. The required action is in the process.
So now let's see the second risk assessment form that we created for the company. So the hazard is frequent contact with surfaces touched often by others, which is door handles, service counters, tools, and equipment. So who might be at the risk? Workers, customers, and visitors. So how to control to eliminate the risk? Clean and disinfect frequently touched surfaces, including your personal workspaces. Bring your lunch, coffee, and snacks from home and avoid sharing foods, utensils, and plates. Sit apart from others. And the last one is wash your hands often with soap and water for at least 20 seconds or use alcohol-based hand sanitizer with at least 60% alcohol. So the actions done by the company is keeping sanitizer bottle or sanitizer machines in every corner of the workplace, giving gloves to all the workers, visitors, or customers before entering into the workplace, and then providing protective clothes to the workers to work even more comfortable. And then lastly, provide walkie-talkie to all the employees to communicate rather than one-to-one. So the required action for the company is in the process.
So let's see the third form of risk management. So identify the hazards, which is working with sick, even symptoms are mild. Who might be at risk? Workers, customers, visitors. And then control to eliminate the risk. Do not go to work. Monitor for symptoms of COVID-19. Greet with a wave or a nod rather than a handshake or hugs. Avoid gathering in groups in break rooms and common areas. Let's see the actions. Put on a mask, tell supervisor and go home in a private vehicle if possible. Isolate from people in your household or work. Consider getting tested. Call your local public health authority for advice. The last one, required action, is in the process. So
now let's see the last risk assessment form. Identify the hazard is taking public transits to work. Who might be at risk? Workers, customers, and visitors. Control to eliminate risk is wear mask, sit apart from others, avoid traveling during peak hours if possible, avoid visiting public places during breaks. In the actions, use private vehicles to work, use physical barriers, and limit the number of people in a space. And the required action is in the process. So now let's see the third question's answer. Produce the COVID-19 prevention guideline among employees in your company.
let's see the prevention guidelines. Physical distancing for workplaces. Encourage employees to stay home and notify workplace administration when sick. If employees develop symptoms at work, avoid contact with fellow employees and inform employees for screening or home surveillance. Encourage staff to late work when feasible. Encourage a no shakeable and shakeable policy. Increase physical space between workers at worksite, 1 meter apart. Second one, symptoms screening and body temperature measurement. Each person, each person should be screened by a trained person or nurse assistant equipped with PPE, which is face mask and glove protection. Anyone with a body temperature of 35 Celsius or above is not allowed to enter the workplace and required to repeat a body temperature measurement. Report to the employee if body temperature measurement remains at 37.5 Celsius or higher for further action. Any person who has been screening and shows COVID-19 symptom is not allowed to enter workplace, and such case should be reported to employer. Use My Sejahtera application or other application approved by MKN or manually record the entry of employee, visitor or client into the workplace.
So the third prevention guideline is workplace cleaning and disinfection. Perform regular cleaning and disinfection process at identified workplaces. Cleaning and disinfection should be done each time before commencing operation for the workplace and 3 times daily for common areas and should be recorded in the logbook provided. Dedicated leaded trash bin must be provided for employees to dispose used face mask, gloves, and tissue papers. The trash bin should have automatic cover, foot pedal, and provide a plastic bag that can be properly sealed and labeled. Employers are required to keep up to date with the latest development information and the relevant directive of COVID-19 by the Ministry of Health through website. So that's all from us. I hope you all understand what we did in the PBT. So thank you to Puan Azrael for giving us this opportunity, and thank you all.